Hi, my name is Haley, student of physical therapy at the University of St. Augustine. Can I have your full name, please?
Grizel Ramirez.
Okay, Miss Grizel. Do you mind if I call you Gracie?
It's fine.
All right, so the other therapists in the clinic have let me know that they've been working with your right elbow for just some tendon issues. You have some inflammation here that they've been making good progress on, and they wanted to do another therapy with you, and that's why I'm here. Before we do this, though, I wanted to make sure that you're safe for this and that you're a good candidate for this treatment. So there's a couple of assessments that I'd like to go through. Did you want to do that with me today?
Mm-hmm.
All right, so the first thing I'm going to do is just look around and make sure that there is nothing that's going to create a barrier to this treatment. So just looking at the integrity of your skin, just go ahead and relax. Doesn't look like you have any open wounds or abrasions, nothing that would present a problem during this treatment. And the second thing I'm going to do is called sensation testing. So I'm just going to brush lightly on your arm and you're going to let me know when you feel it, okay? But for this, I'm going to have you keep your eyes closed and just let me know when you feel it and try not to guess. Okay, close your eyes now. Can you feel that?
Yes.
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 And does this feel the same?
Yes.
Okay, great, you passed. So this means that you can move forward with this treatment called ultrasound, and this therapy is a non-thermal therapy, so you're just going to be feeling the sound head, which is just a little instrument that I'm going to use to do the therapy today, and the gel that's going to be a barrier to the treatment as well, so it gives you a little bit of a frictionless space. It's going to keep this safe for you. So did you want to do that with me today?
Yes.
All right, so what I need you to do is just remove your shoes and to get on the bed on your back with your head facing that way. And I'm gonna go ahead and try to make this as comfortable for you as I can. So I'll help you lift your legs up and put these under your knees. You feeling good?
Mm-hmm.
Okay. And what I'm going to do is have you actually move your arm up a bit. Place this right here underneath you. And you're going to put this arm on this pillow right here, this one here as well. Okay? You comfortable?
Mm-hmm.
All right. So again, this is what we're doing today is ultrasound therapy. That's is not thermal in any nature, so you should not feel any sort of heat. If you do, just let me know, okay, and we'll fix that. So just looking at my instruments. All right, so this sound head right here has an ERA of 2.5 centimeters squared. I can multiply that by 4 to get the effective area for treatment for this biophysical agent. And then it states that it has a BNR of 6.0. And for non-thermal ultrasound, I can multiply that by the intensity of 0.5 to 1 to get the safe energy that would be emitted through the sound head while avoiding any sort of hot spots. So I'm going to go ahead and turn this on. And since we're doing a pulsed non-thermal, I'm going to keep this on a on-off ratio of 10% on and 90% off, just because I'm not sure how she's going to tolerate this treatment today. And I'm going to set it at 3 megahertz because it's a superficial tissue. And we're going to keep the time at 5 minutes, and the power intensity, like I stated before, we're going to keep that at 0.5 so that we can keep our BNR below 8. Alright, so Miss Gracie, I have to make sure that I know exactly where I'm treating today, so is it okay if I find the structure on your arm and then also use this head to trace the area that I can treat?
Mm-hmm.
Okay. So, Chris, can you wiggle these fingers for me, please? Thank you. Here. Okay, is that tender? I'm sorry, I'll put less pressure on that. So, sorry if this tickles. Just gonna make a little circle. Alright, so that would be my first of the × 4 ERA that I'd need to make sure that this treatment gets to where I need to. So I'm just gonna draw 3 more little circles around here just to make sure that I'm staying on target. Alright, so that looks good. And next I'm going to apply some gel, and I'm sorry if it feels a little bit cool, but like I said, this is going to help me create a barrier for this treatment and also make sure that all of these sound waves get to where they need to for the therapy. Alright? Apply that there. Alright, and again, all you should feel is a sound head moving all over your skin. No sort of like pain or heat or tingling. If you let me know, just let me know if you feel any of those and we'll stop the treatment immediately.
Okay.
Okay. So go ahead and put sound head on and start. And I'm just moving this at 4 centimeters a second because that's just the standard speed of movement for a non-thermal ultrasound therapy. You doing okay? Try to scoop this a little bit just to make sure that it's not falling all around her and that we still have some to make a barrier, but just keeping it below that 15 degrees of angulation so that we don't violate the cosine law. Alright, so 5 minutes are up. Stopped and up. Are you okay? Alright, so I'm going to go ahead and wipe this off. And I'm going to wipe you off. And we're going to see how you did. So we can just check around to see if there's any reaction that we didn't expect. And it looks like you tolerated the treatment well, so we can go into some passive range of motion exercises and continue our treatment.